Compliance with the surgeon-recommended supplement protocol that is specific to the operation the patient has is critical in determining outstanding success. We recommend that patients stay away from all liquid calories such as milk as well as sugar. No fluids for about 30 minutes before a meal to about 90 minutes after a meal. Patients must avoid soft, mushy, calorie-rich foods and fluids. Generally, 4 to 5 small, high-protein, low-carbohydrate meals, and exercise 45 minutes a day. Support group attendance helps provide a better outcome overall. Progression of weight loss after weight loss surgery is indicated in this diagram. On the left, in red, is where patients are before surgeries, consuming roughly about 2,000 calories a day. After surgery, patients typically consume about 800 calories a day. The body is then forced to melt its energy reserve or fat to meet its energy requirements, and that brings about rapid weight loss over the next 12 to 18 months. Once the patient has lost most of their weight, they do regain a small amount of weight, and this is inevitable, irrespective of whatever type of surgery that they may choose to have. However, if they do not stick to the protocol outlined earlier and avoid exercise or get into the wrong kinds of foods, this may result in significantly more weight regain than predicted. We recommend that patients come to see us at least once a month during the first year and then every 6 months lifelong. We recommend laboratory work to assess nutritional adequacy every 3 months during the first year and then every 6 months lifelong. Bone densitometry studies, including forearms, are obtained before surgery, a year after surgery, and then every 2 years lifelong. Adjustable gastric band patients are recommended to have annual barium swallow studies. The adjustable gastric band forces patients to eat small, bite-sized meals. It can cause reflux if the band is too tight. Patients with a sleeve gastrectomy typically eat a smaller than normal size meal. There is no malabsorption, there's no dumping. Gastric bypass patients can typically eat a small size meal. Consuming sugars could result in a bad reaction called dumping. More malabsorptive gastric bypass surgeries can result in gas, diarrhea, and body odor issues, particularly if they get into carbohydrates. The duodenal switch operation enables people to eat a near normal meal. Because the pyloric valve is preserved, there's no dumping, there's a low incidence of ulcers, and they may experience some fatty stools and some malabsorption of protein and fat-soluble vitamins. Dumping is an adverse reaction that gastric bypass patients get due to the rapid assimilation of concentrated sugar directly into the intestine. This serves as a negative feedback mechanism for patients to help them avoid sugars. It does not occur in adjustable gastric band, sleeve gastrectomy, or duodenal switch patients because the pyloric valve is preserved. Nausea and vomiting can occur after weight loss surgeries and is typically because patients are eating too much too quickly or are not chewing their food completely. If this is a persistent problem, it must be investigated by the weight loss surgeon promptly to prevent electrolyte imbalances and neurologic problems that could result from vitamin deficiencies. Since weight loss surgeries reduce the stomach capacity and typically increase transit time through the intestinal system, it's important that patients follow a few precautions. All medications should be crushed or taken in a liquid form to prevent irritation of the intestinal system. It's also important to change preparations that are extended release formulation to standard release formulations that may have to be taken more frequently to enable better absorption.